Well, we have a quorum. Let's move on. Can I have a motion to approve the minutes, November 18th? Hold on, who's Jimi Hendrix today? 2020, Mr. Weber moves. Can I get a second from someone?
Silva seconds.
Second by Dr. Silva. Any questions on the minutes, corrections, changes? None? Clerk, could you please call the roll?
Lewis,
Yes.
Shepro,
Abstain.
Strathman. Yes. Tepe,
Yes.
Weber,
Yes.
Silva,
Yes.
Okay, let's move on. Finance and Budget. November Public Health Committee financial reports are attached. Kathy, did Cannell actually want to give any report?
I believe he generally does not.
Well, this might actually be the,
If there was questions.
we could probably
but-
talk about the CARES Act money here just
Okay.
briefly. So I did receive some information that out of the allotment from the CARES Act money for the health department's programs, there is about $1 million, just over $1 million that is expected to be unused. So if Cannell's on, could you just describe very briefly what's in that $1 million that's unused to date?
Hello, can you hear me?
Yes, we can.
Good morning. Well, basically, we've been tracking our expenses based on the funds that had became available to us. And with the major focus, as everyone has been talked about in the past, was that contact tracing, which was the bulk of the funds. Behind that was working PPEs to provide protection to our staff as well as to homeless shelters and other departments within Kane County. The biggest problem has always been the timing of us receiving the funds, because we would never, based on our practice, expend funds until the funds became available from the board. So timing became a problem in terms of us having the funds available, as well as the competition with other organizations, just not locally, but around the country, competing for the same items. So with that in mind, we were not able in all cases to obtain the things that we were seeking. And now we're in the midst of the preparation for the vaccination distribution. And we are expending funds for getting special equipment such as freezers, refrigeration, as well as what our individuals will need in terms of being able to actually administer them in some case, but more importantly, distribute them, which I'm sure is going to be talked about later by Michael or Kathy. That they come, we get them and we have to distribute them, and special equipment as well as equipment such as cryogenic gloves have to be used to protect our employees as they distribute the vaccines. So basically, our biggest issue has been timing. It has been availability in terms of being able to expend the funds, and built into what we're giving, what we cannot expend is basically the timing as December 30th rolls around, that we will not be able to expend it by that time. That does not mean that we do not need those funds for the vaccination distribution, but we will not be able to expend it by the December 30th timetable.
Okay, and then the biggest piece is in the contractual services, about $2 million. And there are some personnel services that get taken out of that, and that's how we arrive at $1 million. What's in the contractual services? Did we spend all the money for the contact tracing that we allotted? Is the contractual services part of that, or is other stuff?
Contractual service is includes some contact tracing. It includes some um, contractual staff that we needed to have, and some that, in terms of professional staff, in terms of nurses, that based on timing of when things were actually going to occur, actually are occurring later, which is part of the preparation for the vaccinations. That basically it's the timing related to when we need the people versus when the funds cut off.
Yeah. Okay, is there anything else of note in the Public Health Department financials for this month?
No, this is year end, and usually finance talks a little bit about our current position. We are basically on par with what we expected to be, and we are in the midst of the month-end closing related to November, as well as a year, which also includes a year-end. So there's a lot of timing issues in terms of booking expenses, and then we also have to take into consideration the COVID, at least the CARES Act, that a lot of that process is going on. So this year has been a tremendous effort for everyone, because basically we are processing more than 110% more than we usually process in terms of requisitions, as well as, and then invoices. So this is a large volume for everyone involved, from us to internal audit to Kane County Finance and the Treasury Office, in terms of what's being flowing through at least our area.
All right, does anyone on the committee that is present have any questions for Cannell Snowden about the public health financials? Seeing none, we'll go online. I believe Mr. Shepro has a question or a comment.
Oh, no, if that said it raised hands, I hit it to see what would happen before we started the meeting. I apologize.
Well, now you know what happens. All right, thank you, Cannell. Appreciate you being here today. Okay, public comments. Do we have anyone here for public comments? Anyone that called in?
Mr. Chairman.
Yes, Mr. Shepro?
Yeah, I don't know exactly where this fits, so I just thought I would mention that as a new member of the committee, they always say when someone does transportation, they say, do you ride the bus? And so I thought, as a new member of the Public Health Committee, I would check out how Delnor Hospital is responding. And so here I am. And I can report that my nurse is about to be one of the first people to get the vaccine. So anyway, it's an honor to be part of this committee, and I look forward to participating.
Well, thank you for being here, and hope you're able to leave your present environment safely soon.
Well, I had a coupon that was good for 3 days free stay, and it expired in December. So I thought I'd better use it.
It's good thinking. All right. Okay, moving on to animal control.
Good morning, everyone.
Go ahead.
Can you hear me?
Yeah, we can hear you loud and clear.
Wonderful. Good morning, everyone. First off, welcome to our new board members. And if anybody has never, and this goes to new and old board members, had the opportunity to tour our facility, please reach out to me. I would love to set something up so you can come out here and see what we do and what we're all about and how we're operating. Especially some of our new board members are into renewable energy. We would love to show you the solar panels if you have the opportunity. Other than that, from our financials, the dust is settling on last year. As we close out the year, it does look like, although a lot of people did not go to their veterinarians this year, we estimated about an $80,000 loss in revenue. We're hoping with the vaccine coming out and with things looking brighter in 2021 that things will return to normal here. It's very important to us as we continue to ensure that we do not cause a burden to the county in any way and we can continue to operate in such a fashion. Our fiscal year ended with our revenue exceeding expenses, which is always our goal, and we try that for every single month. But if anybody has questions at all, please let me know.
I have a question, Mr. Chairman.
Mr. Shepro, go ahead.
Yeah, is the loss of revenue due to people just not getting around to it because of COVID, or are there other reasons for the lack of registrations?
It's the lack of registration is due to about 2 to 3 months of vaccine clinics being closed. We saw a large jump in our mobile vaccine clinics this year, and we still have talked to a couple animal hospitals that have had to shut down because their facility has gotten COVID inside. So it really is a combination of things, and it has been due to the lack of revenue due to the vaccinations. But we can oh, go ahead. I'm sorry.
No, I say, so it's not that people are boycotting it, they can't get in to start the process.
No, not at all. It's really been a safety issue on everyone's concern.
Thank you.
Of course.
Does anyone else have any questions for Mr. Youngstaff? Mr. Kenyon?
Not a question. I want to say we really liked that cat you gave us. When one of my men said, "That's a very nice cat," he said the cat got in his arms. It was supposed to be not friendly, but it maybe only liked farmers. So thank you for the cat.
That is fantastic news, and I will pass it along to the staff. Thank you for the update.
Mr. Kenyon, what did you name the cat?
They had a name. What was the name? I saw it. You gave me it in the tag.
Oh, gosh, I can't remember offhand. I'm sorry. I'll have a few in a moment.
Well, I'll have to come next month and report back. We don't want to have a cat remain unnamed. It's just not civilized.
Mike, have a contest.
Okay.
The cat's name was Captain. We named it Captain.
Well, there you go.
All right, that's a good name. Okay, any other questions or comments?
This is Dr. Silva. Good morning. Brett, just wondering, Aurora is considering a ban on puppy mill sales. I know we've dealt with this issue before. Just wondering if anyone has reached out to you from the city council.
They have not. We, of course, would stand behind it. The problem is the non-home ruled structure of Kane County that limits our ability to do that sort of thing unless the state does it. But yes, this facility would 100% support such a thing. It's just a matter of what are we allowed to do legally per the state mandate.
Great, I am with you on that. And I will more than likely be giving you a call about that. I just wanted to bring it up now so that the newer members of our board could hear a little bit about some of the issues that we have dealt with in the past. Thank you.
Of course, anytime. Thank you.
Yes, and Dr. Silva, I don't know that this committee is the one that would have any bearing on the banning of puppy mills, but I do think it's a good thing that we should discuss and see what we can get moving with the county board. So thank you for bringing up that issue.
Agreed. Thank you.
Okay, we have a resolution from Animal Control authorizing kennel floor replacement for animal control. Can I get a motion and a second to discuss and potentially move this item?
Motion to approve.
Mr. Shepro moves and Mr. Tepe seconds.
Second.
Okay, Brett, could you just briefly describe this one for us, please?
Yes, this has been 14 years in the making. Animal Control has the original kennel flooring inside this facility, and over the last 14 years, it has just worn down. The amount of accidents occurring to staff and animals has greatly increased, and about a year and a half ago now, we did have a severe accident that caused a substantial workman's comp claim for the county. This project would be cheaper than that comp claim would have been in itself, but it's time. It's time to get our floors fixed. We take pride in how clean we keep this facility. We work hard to ensure that it is cleaned, it is sterilized, and it is ready for the animals that come through this facility because our job is to protect them. Part of that is to clean, and in the cleaning process, the floors get very wet and slick. So just over time, they've worn down, and it's time to get them fixed. The company we're requesting is FloorGuard. FloorGuard is also going to do more than the other two companies. They're going to grind it down in such a way to help us fix some of our drainage issues we're also having on in the shelter throughout our floors. This was budgeted in the fiscal 21 year budget as well, and funds are available.
Okay, does anyone have any questions for Brett on this resolution? Anyone present? Anyone
Just a-
online?
Just a comment, having been involved in the construction of the original floor many years ago, I am pleased that we can move to get a new one.
All right. With that being said, clerk, can you please call the roll?
Lewis,
Lewis, yes.
Shepro,
Yes.
Strathman,
Yes.
Tepe,
Tepe, yes.
Weber,
Yes.
Silver, Silva.
Silva, yes.
Thank you. Sanchez.
Yes. Okay, resolution passes.
Thank you, everyone.
Thank you, Brett. On to the Executive Director's report. We have Interim Director Kathy Fosser from the Public Health Department.
Hi, everyone. Welcome. Just wanted to make sure this worked. And it does. Yay. So part of the presentation has always been for the flash report. And so we were going to keep this tradition as long as everyone was happy to do so. So we like to highlight certain things about our public health essential services. And so you're seeing the, obviously, you know, Barbara Jeffers retired, and we're very happy for her. She has done a marvelous job, and, you know, we're all going to miss her, but I know we're all very happy for her. So there is information with her on there, and then we also, so we had a press release for Barb, and then there was a press release for myself as the interim executive director. And then, so that's just, you know, our basic overview. But then if you go down and look at the rapid antigen testing deployed in Kane County, we received these supplies on November 17th, and I asked for a report. Laura Barrett is our director of disease prevention, and she is actually out deployed helping with the vaccination distribution today. Otherwise, I would have had her here to talk about it more. She is a nurse practitioner, fantastic. And so I just wanted to give you her report in addition to this information that's in the flash report. So to date, the Kane County Health Department has administered 425 tests. And of those 425, 20 tests were positive. And the larger groups that we have done with these tests are Hesed House and RevCorps in Carpentersville. We are also working in partnerships with other groups so they can as well do the rapid testing. So we have like a agreement with them, and she has given me a listing of some of those groups, and they do have to get a Clinical Laboratory Implement Act, a CLIA waiver, and then also a medical provider standing order in order to have these. So we can't just give them to anyone. They have to have these special things because the Kane County Health Department is still responsible for these tests. We still have to report them to the state, like every single test, and within 24 hours. So she's listed, let's see, we have 1, 2, 3, 4, 5, 6 of them so far. So Hesed House is on board with us, Aunt Martha's, Vista of Fox Valley, Deer Path of Huntley, Gateway Foundation, and Apostolic Christian Rest Haven Highland Oaks. So that must be a long-term care facility. But so we're pleased that we have this Binax now, which is an antigen rapid test. So I don't know if there's any questions about that. And then I do want to say that Michael Isaacson, our Assistant Director for Community Health, is here, and he's going to be providing a further COVID update. So we'll be able to ask questions there as well. So, okay. And then the next thing that I had is I was just going to provide a basic overview, And please bear with me because I know we have current members and we have new members, but because we're a accredited public health department, it's very important that we provide the board with basics of information. And so I was going to do that today. I talked with, oh yes, the PowerPoint presentation. Thank you. So this will just be an overview of the public health in Kane County and roles and responsibilities. So the first slide is just showing, and I'll keep this really brief because I know we want to go on to COVID. So the first slide that you'll see is we have, it's very important that the governing entities are accountable for the health department achieving its missions and goals and objectives to protect and preserve the health of the population within the residents that we serve. So, and then the next slide will show the 4 entities that are the key decision makers, which is the Illinois Department of Public Health, that's the state. And then I'm going to talk about the things that they do. And then, of course, the Kane County Board, the Board of Health, the elected officials, and then us, or you all, the Kane County Public Health Committee appointed standing committee. And then also the health department has an advisory board, or you all have an advisory board, volunteer board, which I would eventually would like them to come, and I believe they have come in the past, to provide their expert advice, medical advice. And then there's, of course, us. So the next slide you'll see is the Illinois Department of Public Health. And of course, you have seen them all in the news lately. So Dr. Ezike is the one that you probably are familiar with seeing all the time. But so they have the authority and responsibilities to create and enforce state administrative roles and regulations. And they certify the Kane County Health Department. And the certification is very important because that will provide us with grant opportunities. You have to be a certified public health department to be able to get grants and thus money for us. They're also responsible for ensuring that the Illinois rules and regulations around core functions of public health. And then, of course, they have the major offices that I have on there: epidemiology, health promotion, and Office of Women's Health, and healthcare regulation, health promotion, finance administration. And they also have regional health officers that reach out to us too. So that's a nice, good support to have. Okay, and then we get to the Kane County Board. So the Kane County Board created the resolution back in 1985 to have a Kane County Board, the Kane County Health Department. So I actually requested to get the original one because I knew we had it somewhere, but it was interesting. So it was passed on October 8th, 1985. And so interestingly enough, and a lot of you already know that a lot of other health departments, they weren't created by resolution like we were. So we're, I believe, out of all the 101, we're 1 or 2 that are created by resolution. I think it's only 2 of us. So, so that's kind of interesting. And then Kane County Board also serves as policy-making board that holds the health department responsible for enforcing state and county laws and regulations. And the county board also approves policies, budgets, and expenses related to the operations. And another thing that's important to note is the fees that we have, you all approve the structure of the fees. We don't make that decision, obviously, ourselves. So, all right. And then the next slide is the Public Health Committee, the standing committee, which reviews and approves policy, budget, trends related to public health, and provides guidance to the executive director of the health department and makes recommendations to the Board of Health on behalf of the health department. And then consists up to 7 elected officials appointed by the Kane County Board, well, Madam Chair. So the next slide is about the advisory board. So they have the authority and responsibility of providing expert knowledge. And so I just want to say, so they consist of, per the resolution, of physician licensed in Illinois, a nurse licensed in Illinois, and a dentist licensed in Illinois. And then there's others on the committee as well that have an interest. So the way the resolution reads that it shall consist of at least 5 per resolution members. So, and we currently have 7. So I was looking at the list yesterday, and the only concern I have is it looks like the dentist dropped off. So we need a dentist on our volunteer board. So if anyone knows anyone who wants to volunteer, I have some ideas, but okay. And next, I just put up a slide of our basic poster of the Kane County Health Department, our vision, our mission, and our core values. Our mission actually is fairly the newest one. We wanted to make it very simple. So it's to promote, protect, and advocate for health and wellness in the community. And this has been since our strategic plan back in 2016. We actually had a lot of community input into that. So, so we have our vision and our core values, and what are we doing on time? And then next, I just put a basic slide together that we have 4 divisions. We have community health resources, disease prevention, finance and facilities, and health protection. And our budget is, which Canal gave me that number, that we're $9,361,211. We have 75 staff, 65 full-time, 5 part-time, and 5 seasonal on a regular basis. And we have the 2 locations. We have the Aurora, and then we also have a smaller rental that we rent out in Elgin. So I know a lot of you know some of all this already, but I just, for the new members, I thought it's very important.
It's good to have an overview every once in a
Okay.
while, a refresh.
Okay, thank you. And then I think the next one's discussion and questions. And so.
I have a question.
Yes.
Mr. Shepro, go ahead.
Yes. How many of the employees, if any, are funded by ongoing grants as opposed to directly out of our general fund? know-
Okay. Canal, do you have the exact percentage?
Oh, I don't, I mean, just a general
Oh.
idea. I
So
seem to
I-
recall that a large number are through ongoing state or other grants that allow us to
Yes.
provide programs. And I just did not remember how, I know that that's gone up and down over the years with other people's budgets. And I
Yes.
wondered what stood now.
Well, I know it's well over half, but Canal, I know, is he still on with us?
He is.
The
Hi, this is
percentage?
Earlier.
Yeah.
Okay,
Hi, this is Canal.
thanks.
The number ranges anywhere from 45 to 50%, depending upon, what grants we do have.
And are there any that do we have people who are under basically temporary COVID payments that will expire at some point and have to find another revenue source?
Yes, we do have employees that we hired on a seasonal basis. They're considered seasonal staff as part of that category. And we do have employees that were hired specifically under the CARES Act.
And just the last observation, a little quick research discloses that only Richland and Edwards County appear to have no health departments at all. One last question is, the Board of Health, as I understand it from the past, essentially had one annual meeting. Is that still the case?
The Board of Health as in, you mean for the health advisory?
No,
Can you clarify?
the Kane County Board is the ex officio health. That was it on your first slide.
Yes.
The Board of Health, it seems to me that there is one annual meeting that is actually a meeting of the Board of Health, which I think was essentially perfunctory to satisfy statutory requirements, but it does not meet on a regular basis, was my understanding.
Yes, correct. So I believe that would be considered a special meeting that we have once a year that we have not had yet for this fiscal year. That must be what you mean.
Yes,
Okay.
that is.
Yes,
Thank you.
Thank you. Thank you for clarifying.
Thank you,
that.
Mr. Chairman.
All right, anyone else have any questions? Mr. Tepe?
Yes. Mr. Chairman, being new to the Kane County Board and being new to this committee, there are two key areas that I would like to offer my assistance in. One that I'm very interested in is mental health. It's a key factor and high on the list of what everybody is concerned about as far as health is concerned. I'm sure right now that takes a backseat to COVID, of course. But mental health is something that everybody is concerned about. Most recently, there were two new mental health boards created in the county, one in Dundee Township, the other one in Elgin Township. And Elgin Township just on Monday night voted to go ahead with the full levy amount for the referendum associated with their mental health board. And the mental health board has been meeting for some time getting organized. So I'd like to offer my assistance wherever I can to be involved in mental health activities and coordinating that. And the second thing is that I'd like to also, again, offer my assistance and involvement in creating an effective way for people to, one, be informed of services that are available in Kane County, and two, more importantly, coordinating a consistent way for people to be enrolled so that people in Aurora, people in Dundee, people throughout the county were all being tracked and treated in an equal manner. So, thank you.
Appreciate your comments, Mr. Tepe. It sounds like you're looking for some projects to work on, and I'll be happy to oblige. Any other questions or comments for Interim Executive Director Kathy Foster?
Mr. Chairman,
Mr. Shepro.
COVID-related questions, I presume you would defer till we get to that portion of the agenda?
Yes.
Oh, thank you.
Okay, moving on.
All right. So the updates for COVID-19, I have Michael Isaacson, Assistant Director for Community Health, who has also been our incident commander in our incident command system that we've been using as we've been working through COVID. Is
Good
Michael-
morning, everyone.
Great.
Can you hear me okay?
Yes, we can.
Very
Go ahead,
good.
Mike.
Well, I'd like to also extend my welcome to the new board members. We are very much looking forward to working with you to improve the health of our residents. I put together a few slides as a basic overview, more for the new members. And then I assume we can spend some time answering more specific questions that people may have. Also on the phone is Uche Onwuta, who is our director of our Division of Health Protection, who's also been a very key part of our COVID response. So I could get the next slide, please, Blair. So what are some of the basic roles that the health department has been fulfilling as part of this pandemic? One of the key interventions that we do is conducting investigations and conducting contact tracing. So in simple terms, what this means is we want to identify people who are ill, give them the proper guidance so that they know they need to stay home, which we call isolation. That prevents the spread of disease to other people. We also want to find out who they may have been in contact with in the period that they may have been transmitting the illness. That's called contact tracing. And we follow up with those individuals and then ask them to what we call quarantine, where they also stay at home. In this case, it's typically 14 days for COVID, so that we prevent the spread of illness to additional people. So for the ill people, we don't want them to give it to anyone else. For the people who may have been exposed, we're asking them to restrict their movement and exposure to other people also, so they don't give it to other people. We're also very busy working to mitigate outbreaks. Unfortunately, we've seen a lot of outbreaks at long-term care centers throughout the course of this because of the susceptible populations and people living in a congregate setting. But we have many businesses where our team has been working really hard to provide the appropriate technical assistance. As Kathy mentioned a little bit earlier, in some cases, we'll go in and do antigen testing to try to identify people who may be sick so we can separate them from the well people to limit the spread of illness. That goes along with administering the COVID tests. As Kathy mentioned, we've administered less than 500. So we are not one of the large providers of COVID testing in the community. Us providing these antigen tests is actually something that's come along pretty recently, but it is a nice resource that we have that's being made available to us. The test kits come down to us free. We do have a toolkit that we have available for any organizations that are interested in exploring potentially using those in the future. Educating the public, especially with the vaccine coming. This is actually a very exciting day to have a first public health committee meeting where we have vaccine actually rolling in Kane County for the first time. So I don't know if people saw the Kane County Connects today, but I appreciated Madam Chair's comments about how this really is a turning point. We've had many months where we've struggled with this illness, and being able to get vaccine out to people is something that's going to be tremendously helpful in getting us back to normal life. Analyzing the data, we have people at the health department that we call epidemiologists who study what's going on, so we can identify where there may be pockets of illness, who's being most affected. That information really helps us to plan so that we make sure that we are putting the appropriate interventions in place. An example of that, this afternoon at 1 p.m., we're going to have a special discussion specifically looking at disparities related to COVID. So we'll see how some populations in Kane County have been more directly impacted, unfortunately. We also have distributed personal protective equipment to key sectors. So that may be law enforcement, first responders, our hospitals. It could be meat packing plants if there's a need there. We have a robust system where we were responding to people's requests, long-term care centers, et cetera, to make sure that they had masks, gowns, gloves, especially early in the pandemic when the regular supply chains were a little bit more disrupted. Right now, we're going to be moving forward into vaccine distribution, so that's something we'll talk about in more detail. Responding to public inquiry, certainly as everybody knows from the national and local media, opinions about COVID and how to best respond to it vary dramatically. So we try to provide science-based information about how people can protect themselves and protect others in their community. And we get a lot of inquiries from both the media and the public that we spend a lot of energy responding to. And then finally, providing technical assistance to specific sectors. So we work closely with the business community, provide them guidance on how they can keep their employees and customers safe. We meet twice a month with faith leaders from around the community to talk about how we can get people back into houses of worship in a safe way. We work specifically with food processing plants because just due to the nature of that work, there may be slightly higher risk. So we want to make sure they have the appropriate measures in place. We work very closely with our homeless shelters because that's a place where there's also increased risk. I mentioned long-term care. This is an area where we have a lot of attention because we want to make sure that we can keep those residents and staff as safe as possible. And then we provide ongoing guidance to the medical community using the newest information that comes to us from either the CDC or the Illinois Department of Public Health. And then we are working very closely with our schools. We meet on a weekly basis with the superintendents, provide them guidance. Just a note, the approach here in Kane County is that we really feel like at the local level, people have the most knowledge about what's going on in their community. So we work with the superintendents, provide them with the most up-to-date information, and then support them in making the decisions that make the most sense for their students and families. Next slide, please. I wanted to just share a couple of places where you can go to look for data if you're new to the committee. So kanehealth.com is the health department's website. We do have a dashboard that we update every weekday that has information about where cases are. You can see there's some demographic breakdown of age and gender, as well as you can click on specific municipalities to see where cases are. So this is a nice resource where you can get up-to-date information about what's happening specifically in Kane County. Next slide, please. Another place that has a lot of good information is the Illinois Department of Public Health website. And I'm going to show two slides here that I think are relevant because they tie into the mitigation or the enhanced rules that the state has put out. We're in Tier 3 mitigation right now. Those decisions are based on regions. And Kane County is in Region 8, along with DuPage County. So if you look on the IDPH website, this is a nice place where you can see up-to-date information about test positivity and hospital capacity. So on the left there, and I went ahead and this represents since the summer, you can see that the dramatic increase that we've had in test positivity. So what the positivity is out of the tests that we do, what percentage are coming back positive? Our goal had been 8%. As you could see in late October and through November, as positivity peaked around not only Kane County, but also Illinois, we moved up into that higher level of mitigation where the state imposed some additional restrictions on residents. And so now the goal is to get back down below 12%. So you can see over the last couple of weeks, we were very concerned about Thanksgiving, but knock on wood, so far we have not seen the overwhelming spike, although we still have way too much COVID activity in the community. Over on the right, there's another measure that we look at how many beds are available. So that's something that the state uses when determining mitigation. You can see that we would like to have at least 20% capacity for both ICU beds and med-surg beds. For this chart, I just showed the last 30 days, but you can see that we've been bouncing just above and below. So our hospitals are quite busy right now. It's come down in activity a little bit over the last few days, but over the last month, we've seen a dramatic increase in who's hospitalized. And next slide, please. This slide shows how many people are actually hospitalized. I also pulled up a 30-day view for this, just to show the orange dots are daily decreases, the blue dots are a daily increase. If I would have shown a wider time period, you would have seen a sharp increase, but I wanted to have some good news. So you can see over the last month, we have slowly been declining in the number of people that we're seeing in the hospitals. So this at least is good news. There's a lot of information out there about who's in the hospitals. We do hear that there tends to be some younger people who are in the hospitals now, and that potentially they may not be as ill. That's true, but I think it's really important to point out that with the tremendously high volume of cases we still have, we're still seeing way too many people who are seriously ill, and the number of deaths that we're seeing in Kane County is still 10 times what we were seeing in a week compared to the summer. So even though we're seeing some changes in who's going into the hospital, and some people, it may not be as serious, still serious enough to be hospitalized, but the medical providers are saying it may not be as serious, not as many people in the ICU, not as many people on ventilators, but the volume is still very concerning. Next slide, please. So just wanted to briefly touch on vaccine planning. So today we have vaccine rolling out in Kane County. So that's very exciting. This is going to be something that's going to continue to evolve. So it's Pfizer vaccine that's out today. It received emergency use authorization last weekend. We expect that by this weekend, the Moderna vaccine will receive emergency use authorization, and we hope to see that start rolling into Kane County next week. But the quantities of vaccine that we can expect to see, and over time, the numbers of different vaccines, those are variables that we don't have all the details yet, so that information is going to change. Additionally, the priority groups. Right now, we are really focused on medical personnel and serving our long-term care centers. That's what we're calling priority tier 1A. After that, there are draft tiers, but it is subject to change on the national and state level. So we ask that people stay tuned, and we'll provide more information as that gets cleared up. And then under Madam Chair's guidance, we're going to be launching some new communication efforts to better keep the public informed. So we'll be walking the fine line of having not all of the information we need to keep people fully informed, but we want to give them enough information that we can at least let people know where we may have opportunities for them to go and get vaccinated as soon as we get that information. And then just a final note on the vaccines, it is really important that we get enough people vaccinated so that we can get protection. I always like to include this slide. I included this last month as well. This whole pandemic is really up to every single one of us making good individual choices. So as the holiday season continues, we just ask that everybody's really thoughtful about who they're going to be around. The more people you're around, the more risk there's going to be. And think about the health conditions and the age of the people you may be around. And then also, what precautions are you going to take? So masks definitely reduce risk, and social distancing reduces risk. So even though we have vaccine coming, we still want people to be taking all of these common sense steps, even though they may be an inconvenience, they literally can save people's lives. And then the final slide is just a couple of examples of information that we have out there for the community, encouraging people to watch their distance and wear a mask, because both of those things really do help stop the spread of illness. And with that, I think we can open it up for questions.
Do we have any questions or comments from members present? Mr. Tepe.
I have one question. As multiple vaccines become available, will the same organization be distributing more than one vaccine?
That is possible, yes. So depending on what vaccines people are ordering, they may choose to stick with one just to keep it simple. So the vaccines, these first two vaccines that are coming out are both 2-dose vaccines. So in that case, it would be much easier for an organization to just continue to get the same vaccine, so that when they give the people the second dose, you need to give them the same vaccine that you gave them the first time. But there may be cases, depending on the organization, that if they're large enough, like a CVS or an OSCO, they may have multiple, but that would be their discretion.
I have a question, please. This is Mavis Bates.
Ms. Bates, go ahead.
What about the jail? Are they going to get priority, the people inside the jail?
Absolutely, yes, and welcome. I live in your district, so glad to have you aboard. But yes, absolutely. Prisons and jails are an area, because it's a congregate setting, there is increased risk. So they are going to be one of the higher tiers before the general public.
Thank you.
Mr. Chairman.
Mr. Shepro, go ahead.
Yeah, Mr. Isaacson, it's good to renew our acquaintance after my long absence.
Yes, good to see you.
A couple of questions. One is the local health department the legally designated? Are we the source, or you the source for the delivery and the determination of distribution of the vaccine?
I think with this process, ideally, it's going to continue to become more and more diffused. So as more vaccine comes into the community through a variety of different ways, We fully anticipate that vaccine will be direct shipped to many vendors so that ideally in a few months, residents are going to have a lot of options. So they could go to their personal physician, they could go to the drugstore. So all of it will, the simple answer is all of it will not come through the local health department. Right now, though, it is.
And I presume at this point, we're not charging for the vaccine that's being distributed, but I guess my follow-up then would be, if it starts being distributed through local vendors, physicians, et cetera, will there be any overarching regulation of that? I know with the COVID testing, people were reporting you could go one place and get it for free, and other people were saying it cost me $200 and things like that.
Sure. So the vaccine will be free. However, individual providers will be allowed to charge an administration fee. For many of the providers that we've been working with, they're looking at billing insurance and not requiring a cash payment for that. But certainly there is an expense for them to administer the vaccine. So that is something that the federal government's made allowance for.
Has there been any discussion or policy created as to either, require vaccine or take other alternative employment? I know that some of the fire districts are wrestling with that issue right now, and that there have been some lawsuits in other states, not with respect to this vaccine, but vaccine in general, as to what health or hospital workers do when they are potentially in contact with a vulnerable public.
Yeah, that's an excellent question. And there's a lot of discussion going on right now. Caveat, I am not an attorney, so I can't speak to the legalities of it, but I have been in several discussions with attorneys and different employers. And because of the newness of this vaccine, that it's just coming out, I think there's many more unanswered questions about what you just raised. So I'll be curious, but I have not heard directly of a lot of strong movement to require it in the near term. Could that change over time? It certainly could, but that starts to get out of my scope of expertise. I would defer. I don't know. Oh, sure.
Yeah, I just say I could report anecdotally that I asked some of the people here at Delnor, and they have reported that so far Delnor is not requiring anybody to take it, but they indicated that it's under the review, I'm sure, by their legal people as well. This is one follow-up, and this is not a question to be answered today, but just in reading newspaper stories about people who are complying, not complying, local governments who are saying we will or will not enforce either health department or the governor's regulations. I wondered if there is, or if there could be, something for this committee that would outline, who the enforcers are, what the extent of the county's authority to enforce is, and if relevant, what experiences are. I've seen everything from some city councils which have said they're directing their police department not to enforce, and others saying we won't enforce unless the health department refers a prosecution to us. And it seems to me that is very confusing, and I think we might all benefit from knowing what the ground rules are. That's just really a question and maybe a request, Mr. Chairman, that you could follow up with.
Sure, yeah, we can talk about that outside of the meeting. We're running a little low on time. We still have to get to a resolution. So if you have any more questions, you can direct them to me and I will pass them along. Or if you want to send them directly to Mr. Isaacson, feel welcome to do so. I know he needs more work to do, right, Mike?
Yes, sure. And Mr. Chair, I would just say with Uche Onwuda on the call, she is one of the experts at the health department. So I don't know I know we're short on time. If there's any comments she has, but also she's a great source if people have questions. But I'm happy to take questions as well.
Yeah, Uche, did you have anything that you wanted to make sure you included in today's meeting?
Good morning. I just want to thank you, Mr. Chairman, for recognizing me, and I want to welcome the new members to the Public Health Committee. I think Michael did a good job with the presentation and covered most of the topics, but if anybody has any questions, I'll be happy to take them.
All right, thank you for being here. We do have a resolution authorizing personnel replacement hiring for the Kane County Health Department, Community Health Specialist 3, Data and Quality Coordinator. If I could get a motion in a second to discuss and potentially pass this resolution.
Motion to approve.
Mr. Tepe motions, Mr. Shepro seconds.
Thank you.
Mrs. Foster, could you give us a brief explanation of this?
Sure. So this position is in our budgeted headcount, and the person who vacated this position actually still is employed with the Kane County Health Department. She moved to a epidemiologist position. So we're looking to fill this one. This one is partially grant funded through our Public Health Emergency Preparedness Grant. And it is also serving in the capacity currently for our documentation specialist for COVID. And this is essentially like our numbers, another numbers person that's very important and key to our operation. So I can take any questions.
Okay, if there are any quick questions from anyone on the committee, I will entertain that at this time. Being none, clerk, please call the roll.
Lewis,
Lewis, yes.
Shepro,
Yes.
Strathman,
Yes.
Tepe,
Tepe, yes.
Weber,
Yes.
Silva,
Silva, yes.
Sanchez.
Resolution passes.
Thank you.
Okay.
Mr. Chairman, motion to place the reports on file?
Yes, 1 second, Mr. Shepard, you're getting just a little ahead of me.
Sorry.
We have old business. There's nothing for that. Okay, you're right. Let's place reports on file. I have a couple comments. I'll leave that for new business. Motion, Mr. Weber, second, Mr. Shepro. Clerk, call the roll.
Check.
Lewis,
Lewis, yes.
Shepro,
Yes.
Strathman,
Yes.
Tepe,
Yes.
Weber,
Yes.
Silva,
Yes.
Sanchez.
Okay, no need for executive session. Under new business, just very quickly, want to welcome everyone to the committee that wasn't here before. I'm happy to be sitting in the seat, filling for some big shoes that have come before me. We have a lot of work to do going on with COVID-19, and hopefully we're not going to be too busy. But I did send an email out to everyone just asking, what are some of the sources of information that you look for about COVID-19? What are some of the topics around COVID-19 that you would like to see discussed in this committee? And then also outside of COVID-19, what other things that are public health and health related that you'd like to see in the committee? So I've gotten some responses back. We'll talk more about that next month and going forward over the next 2 years on this committee. But I would like to just let you know that I am interested in bringing a little bit more conversation to this committee as we go along about health, fitness, things like that. Stuff that is good for the community to talk about. The big work that we have is dealing with the Public Health Department, which is an official source that is has a certain scope, and not to say limitation, but there are certain things that Public Health Department doesn't get into. And the public would like to hear a little bit more from the county. Hey, just promote some good things, not just talk about how many deaths and things we have going on. So going forward, look for that. And I'm still waiting for a few more responses of people that might have some. There's one more thing, Blair, if you could pull up that website that I sent you. I did ask for COVID resources. It's always good to share good information. So this is one website I wanted to share with everyone. It is it's out of the University of Minnesota. CIDRAP is the organization, and the main guy, Michael Osterholm, he's actually part of the Biden transition COVID team. And I just wanted to outline this website for you because there is a wealth of information. If you scroll down a little bit, you have there's a lot of stuff for you to explore here, but right there at featured resources, news and perspective, those are the two main areas that I look at. The featured resources, that's where they place a lot of the ongoing science and research that's being done regarding COVID. So if it has to do with vaccinations or, you know, in-house transfer, things like that, they post a lot of research. So if you're looking for some of the latest stuff on there, like such as the safety and efficacy of certain vaccines. And then the news and perspective, they do a good job of collecting a lot of the news stories related to COVID-19, and they do news scans, things like that. And if you scroll up one more time on the right-hand side, you'll see a little bit more. You'll see under COVID-19 content, there's a lot of stuff there. The maps and visuals is the last thing I wanted to point out. If you could click on the maps and visuals, the bottom of that list there, there's a ton of links there for dashboards and maps. Some people like to look at different sources. We have our Kane County Health Department. Obviously, we tell everyone to go there first. That's sort of our first line of information. And, you know, with the State Department website, but this is just a great wealth of resource, this website. So I just wanted to share that with everybody. This is what I look at. And yeah, so we'll cover other things that people share along the way, but I wanted to leave you with that. So if there are no other questions or comments from the committee.
Mr. Chairman,
or
just really quickly.
Mr. Shepro.
Yeah, on that, your slide with the map list, the Johns Hopkins website is, I found, one of the most information-rich sites in addition to the one that you put up there, and I would recommend that that's a good place to go for information as well.
Yes, thank you, Mr. Shepro.
And thank you for letting me talk too much.
We'll work on it. Puzzle for you, don't worry, Ken.
Yes, I know.
Okay, all right, if I could get a motion and a second to adjourn.
I'll move.
Mr. Shepro moves, Mr. Weber seconds. All those in favor?
Aye.
Aye.
All right, we are adjourned. Thank you all for being here.